well water, yes.
Yeah, this happens all the time. My patients come in, they say, oh, I had a little bit of well water. And I said, well, I wish you hadn't done that, so-and-so patient. I could pick on you. I could say Trish or something like that. And then you say, yeah, okay. Well, anyway, I did. So, and then I do the treatment, and then let's say I'm failing, right? Let's say I'm doing a terrible treatment, which I never do. Then at the end of the treatment, I have to give them like a heavy metal chelating agent to pull the heavy metals out of their blood and out of their organs and glands because I failed. I didn't succeed.
How do you get it out of their body?
So if I succeed, I just do the treatment for the heavy metal toxicity in my office by addressing the cause structurally, chemically, and emotionally. And they're doing so well, they don't need anything to help with the heavy metals when they leave my office. But if I fail, I can still help them.
Or if they fail because they didn't listen.
Well, nobody's being blamed for anything. It's because we're human. That's why.
So then how do you detox them then?
Well, I get to the underlying structural, chemical, and emotional cause of their heavy metal toxicity. There's really just three things in life, Trish, if you think about it. There's love, there's money, and then there's you. Your roles in life. Your role as whatever role you have, right? You could have a role as a mother, a daughter, a sister, a cousin, whatever you have, a friend. Then when it comes to money, there's money itself, there's career, there's time, space, property, groups of people, and then there's religion. In your case, I would say out of all these things, maybe, I'm just guessing, your career could be one of the most important, right? And then when it comes to the career, we could find out what organ or gland an emotion that has to do with the career would be stored in. So let's say it has to do with the colon. So do you tend to be a fairly neat person, or do you tend to be a little bit more disorganized?
No, I'm super OCD. Mm-hmm.
That's the colon. So maybe you're having some emotions that have to do with your colon, that have to do with being really neat or dogmatically positioned. Maybe you want to defend yourself with whatever I'm about to say next. Like, no, Dr. Skolnikoff, I'm neat, but I don't have the thing that you're about to talk about.
Yeah, what is that?
And whatever it is, it's true. Otherwise, you wouldn't be laughing. Then when we bring up those emotions and we have them on the radar, then we can treat them with herbs or homeopathy or nutrition or flower essences. And that's what the Skolnikoff method is all about. Now, we could do that in an infinite number of ways because there's an infinite number of emotions and there's an infinite number of different experiences that any human can have. And there's over 5,000 different homeopathic remedies and lots of different flower essences, lots of different herbs. Did you know that there's a company in Australia that's called MediHerb, and this company makes hundreds of different kinds of herbs, and you can just buy them, like the highest quality tested herbs. They put them through these little graphic machines to make sure that the active components in the herbs are really good. And it's possible, even as an American, somehow, even though I've never done it before, you can get these herbs from Australia. You can get them imported, and you can use them if you need to. Of course, it's going to be really expensive, and you never want to do that. But did you know it's possible?
Wow.
And that is far more effective than any kind of drug made in a laboratory with synthetic materials that are secondary, crappy materials that are inexpensive because all they want to do is make a profit. That's why they spend all that money into research and development of a pharmaceutical medication. And then they spend all the money into defending their lawsuit once they get sued because all the people are dying. And they know all about all those deaths and everything before the product even goes out into the marketplace. You don't believe me? Buy the book.
Yeah, absolutely.
Toxic Psychiatry and Talking Back to Prozac by Peter Breggin, the well-known psychiatrist, who also wrote a really cool book called COVID-19 and the Global Predators, and You're the Prey. So he's great. He's getting older. He's in his 80s now. But yeah, this has been known for a long time. So most of these things that I'm talking about, most people don't know about, right? That's why you're asking me about the well water. That's why this is so important, because you're like, millions of people.
Mm-hmm. Let's talk a little bit about hormones.
Estrogen,
yes, estrogen and hormones, because all ages, not just as you're getting older, as I am, but all ages, hormones plays a big part. Tell us about hormones.
I'd love to tell you about the hormones. And before I do that, may I ask, do you use any hormones, Trish?
Yes, I do.
What kind of hormone do you use?
Just a little 0.50 of the estrogen.
0.50 on the estrogen. Is it topically used, or you take a pill, or how do you?
A little blue pill.
Okay, a little blue pill. I'll be okay, and so will you. I know that God is taking care of us both. So let's pretend I'm a medical doctor, and I hear that you're taking estrogen. I would tell you about all the benefits of estrogen, and I'd tell you that's a good thing, that's going to help you. And then I would be really busy, and I'd get back to my family immediately. That's what would happen.
Right.
Now, on the other hand, let's say I'm myself, and I'm a licensed healthcare provider whose mission in life is to help people the way I wanted to help my father, who died of Parkinson's disease, lymphoma, and prostate cancer, and heart disease, and because he would never let me help him with his health, nor would many of my other family members. And if anytime they let me help them a little bit, all of a sudden they feel a lot better for like 6 months, and then they could come back to all their diseases again where they need medication. So if I am myself and I find out that you're taking estrogen, I would want you to understand what estrogen is, because estrogen is not a vitamin. It's not a mineral. You cannot be deficient in estrogen. You can have low levels, or you can have high levels. You can overdose, but you cannot be deficient in a powerful chemical messenger that alters almost every, not every, in thyroid hormone, yes, but most of these hormones will alter almost every organ or gland in your body. So, for example, estrogen causes tissue to grow. So it causes things to, it's kind of like a key, right? So you turn the key, and all of a sudden the thing starts to work properly. And you'd think that it wouldn't work without the key, but the key is really always there anyway. So you have your ovaries and you have your uterus. So you're having organ failure. So your ovaries are failing to function. And nobody ever told you that. They never told you, but they gave you the estrogen. And now because you take the estrogen, which comes from the ovaries that are failing, they're failing more. Your body's making less estrogen because you're taking what's called exogenously, from outside to in. Your body makes its own estrogen. It doesn't matter if you reach an age they call menopause, or if you're doing whatever you're doing, your body still makes estrogen. In fact, a male always makes testosterone, and a female always makes estrogen. And both sexes have both hormones, and we have them throughout our life. It's true that during a certain time of our life, whether you're a male or female, especially for females, they don't have any more eggs to release from their ovaries, so they stop releasing the eggs. So they have lower levels of estrogen and progesterone than they did before that happened. So that's why they have the Wisdom of Menopause by Christiane Northrup. She talks a little bit about how a woman should become wiser and smarter and sort of more worldly when they reach menopause. And in almost every culture except the Western industrialized kind of culture, we look to women as our guide. They're the leaders of the tribe, right? They're the ones that we all go to for advice and to do the right thing. And it's only in the Western world, with all the craziness, that we just brush them aside and put everyone into an old age home when they get older, which obviously is not so wonderful culturally speaking.
So let me interrupt and ask you then, why am I taking estrogen?
Go ahead.
Why am I taking estrogen then?
You tell me.
I assumed I was taking it because if I stopped taking it, I might start getting sweats.
Exactly. So you have organ and gland failure. You're making it worse with a hormone that comes from the organ or gland. In your case, as you know, the ovaries are here a little bit. I'm sorry, the uterus is here, just a little bit below the belly button, and the ovaries are just off to the side, a tiny bit higher than where the uterus is.
But I don't have, just not to get too personal, but I don't have a uterus anymore.
Yeah. So if you don't have a uterus, if you don't have a uterus, but you still have ovaries, then you really need to be concerned about your energy and your health. Because as you might remember, before we started this podcast, if you want to call it that, or interview, you were telling me that you're very healthy. You don't need help with your health. So you have a thyroid condition that's undiagnosed and not treated. It's being covered up with estrogen replacement therapy, which is the known cause, according to the Million Woman study, of cancer, right? It's one of the leading causes of cancer, which causes, because of all the anti-aging clinics in my particular area, me being in Northern California and San Rafael, California, at least up until about 5 or 10 years ago, maybe 15 years ago, we had the leading number of, breast cancers of any other part of the country. So, and I don't have proof of this, but it seems likely that it's because of all these, hormone replacement therapy centers that are nearby, and everybody being told how great it is to use hormone replacement therapy. Nothing could be further than the truth. Poor Arnold Schwarzenegger had open heart surgery. My friend Sylvester Stallone also had to have a heart condition, they did their procedures and whatnot. But Sylvester Stallone and also Arnold Schwarzenegger were using hormone replacement therapy for many, many years, and they may have looked nice, in their movies and in the mirror and whatnot. But what they did was not only really dangerous. Arnold Schwarzenegger had to have part of his jaw surgically kind of decreased in size because he was having too much bone growth, right? He was having too much hardening of the bones, which is one of the things that testosterone does. So, these kind of chemicals your body makes. So you need to balance your hormones in your system naturally, so you just feel great and you don't have to lose any more organs or glands. If you're missing...
I know you're not giving medical advice, but I need to check with my doctor.
I am giving medical advice. I'm saying that it's wrong to remove an organ or gland that you need without getting, 5 or 10 different opinions. And I'm also saying if it's going to save a person's life, they better remove it right away. Not a lot of people know what I know. Not a lot of people do what I do. Not a lot of people have the eyes that see and the ears that hear and the taste that tastes that I can taste and hear and see and smell. So because they don't have that, they don't know what I know, right? So if you're treating a metabolic thyroid condition by removing an organ or gland, you're not treating anything. You're just getting rid of an emergency with emergency medicine.
Right.
But if you address the underlying cause and you heal the person, they don't need to have all these surgeries. I know we're kind of going backwards. So we want to address what caused you to need to have your uterus removed years and years ago. Now, right? It's not too late. You're still alive. You're still healthy, like you were trying to explain to me. And so when you get to the underlying cause of the thyroid condition, now the thyroid regulates most of these hormones in general. I'm not being specific, but it's the thyroid that helps to metabolize, along with the adrenal glands, estrogen and progesterone and dopamine and serotonin and brain function, and it works with the hypothalamus and the pituitary to allow you to have healthy hormone balance. And if it's not working right, it's because something's wrong somewhere else in your body, because 90% of thyroid symptoms have nothing to do with the thyroid. It sounds like you didn't even know you had a thyroid condition.
I don't.
There you go.
I do?
No, I don't think you do. I'm telling you what you have. I'm not thinking about it.
I know.
I'm an expert in this area. I wrote the double book about it. I've spoken.
I'm just sad because I think the doctors that I've gone, the average doctor doesn't know. So they don't
know, Trish. They have testosterone replacement therapy clinics that they open up to give to men who can't get up off their couch after watching TV with the belly. And then the men start taking the testosterone. They feel better. They develop a few muscles, and you will never convince that man to stop taking testosterone. Meanwhile, they're developing a heart condition. They're messing up their bones because they're having too much hardening of the bones. So they're developing a very odd kind of osteoporosis that you'll never find on a DEXA scan, because the DEXA scan doesn't check the health of the bones. It's just checking the bone density. It doesn't check to see how healthy bones are. They're checking how much calcium is there when you run an X-ray through the bone.
If somebody
X-rays are poisonous. X-rays are dangerous. They kill living tissue. So you're running, even if it's a low level, you're running the X-ray through the bone. The X-ray hits the bone. It doesn't go past the bone. It gets stuck with radioactive material in the bone, and they convince everyone, yeah, oh, Trish, don't be concerned. There's less radiation in that X-ray than there is in a flight from here to California. You gonna come visit me? Don't worry, it's fine. Who do you think gets the most number of blood diseases? Flight attendants, pilots.
Mm.
So maybe there's not a whole lot more than a flight from Florida to California, but there's a lot of radiation you get exposed to in a flight from Florida to California. Nobody's talking about it, except for me and my colleagues, of course.
Because you can't. It's like, I guess it's like the electric car,
That's right. The censorship is big.
Mm-hmm.
Yeah.
Well,
let people talk about that stuff, and then they can't. Nobody hears what they have to say anyway. They get shut down. They have no platform.
I thought for me with the hormones, if you stop taking hormones, you sort of get masculine, but that's not true.
If you stop taking hormones, you might live longer.
I don't even know why I take hormones, if you want to know the truth. Exactly. The doctor told me to.
So you can have a problem with water, protein, blood sugar, digestion, vitamins, minerals, amino acids, carbohydrates. You can have problems with those things. You can take a lot more, or you can have a lot less. You can't have a problem with a hormone unless the gland or organ that the hormone comes from is diseased and pathological. So you have a diseased pathological organ and gland. How do I know? Because it's missing. I'm not making this up. I'm not guessing. I'm not coming up with stuff. I'm not giving you my opinion. I'm not telling you what I feel like today. I'm not letting you know about my mood. I'm not doing any of that. All I'm doing is saying common sense. The organ's gone. It's called a uterus. It's just not there anymore. It was diseased. You're taking the hormone that came from the diseased organ. Why not address the underlying cause of the disease? Disease meaning dis-ease. Your body's in an uneasy state. It's out of balance ever since before. I don't know how many days, weeks, months, or years before you had the hysterectomy, but at some point before that, it was diseased. Why not address the powerful psychosocial, emotional, spiritual causes of the disease, not just the psychosocial, spiritual, emotional, psychoneuroimmunological causes of the diseases? Excuse me, but that's what it is. But also the chemical, emotional, and structural causes of the disease. And if you do that effectively, which is what I'm preaching and houting and hollering about, then of course, like my patients who have Graves' disease, you can get better. It's not an uncurable thing. You don't have to have your thyroid removed like a lot of people used to do 24 years ago. If you have Hashimoto's thyroiditis, you don't have to suffer with it for years and years and years. You can get better. But you can only do that by addressing the underlying causes of the health concern. If you're deficient in iodine, taking iodine won't help. If you're deficient in zinc, taking zinc won't help. If you have a hormone imbalance, taking hormones won't help. If you don't drink enough water, drinking more water may help a little bit, but not really. You have to address the cause of not drinking enough water. You have to address the cause of having the low hormone levels or needing to have a hysterectomy. You have to address the cause of the low iodine. You have to address the cause of the low zinc. If you just take the product or whatever, you're just treating the symptoms. You may feel better, like a lot of these functional medicine doctors will have you do. They'll have you feel better, but you're just treating the symptoms. And after you run out of your beta carotene or vitamin C or vitamin E or your special vitamin K2, which has been well researched to improve bone health, then you have to buy more. Why not just get healthy and eat the right food and digest it and get to the underlying causes of your health concerns? And maybe you do need to take a few supplements. Some people won't get well without them. I mean, obviously, if you have these hormone imbalances, which you do, and you're taking the hormone all this time, you can't just stop taking it. You have to address the underlying causes of the hormones. These hormones have biochemical pathways that are driven by nutrients. It's a niacin driven biochemical pathway. That's called the doctors talk rate limiting factor, meaning there needs to somehow be more niacin in your diet or in your system, chemically speaking. But there's also, vitamin C, and there's, things like There's enzymes, right? There's different kinds of enzymes that you need. It's not just vitamin C. Vitamin C is just ascorbic acid, but cataplex C, or the vitamin C complex, involves, dozens and dozens of different nutrients. One of them is called an enzyme called tyrosinase. And you can only get that from certain kinds of, whatever weird kinds of beef liver or whatever it is. But I mean, so you can't just take a hormone and expect things to go well, but that's what people are being taught. They're being taught there's a pill for every ill. There's a lotion or a potion for every problem. If you have restless leg syndrome, we're going to give you the pill for it, and you're not going to have it anymore. Instead of figuring out, well, wait a second, what is restless leg syndrome? Why does a person get it? How does it come about? How do you get rid of it? And how do you keep it from coming back? If I had a lot of pain, which I'm so fortunate not to have, thank you, God. If I did have a lot of pain, I wouldn't want to go to a pain management clinic. I would want somebody to figure out, how did my pain get there to begin with? How can we get my pain to leave my body? Pain, by the way, is an emotional experience registered in the limbic portion of the brain, which is the emotional center of the brain, kind of right near the fourth ventricle where the hypothalamus is. And then there's also the pituitary and the pineal gland there, okay? So knowing that pain is an emotional experience, I would want whatever healthcare provider I went to see have emotional therapies that they could do with me to help me to get rid of what was causing my pain. And then I would also want to know, if my pain is gone, how do we get my pain to no longer come back? How do we keep it from returning? I don't want my pain to be managed. No pain management. I just don't want pain if I have pain, right?
Okay, right. So let's say
I don't want balance if I have one. I want to know how to get there.
Okay, so we all believe you, and it's a little shocking, but we believe everything you're saying.
I'm in shock.
Now, we're all going to get your book. We know that, but let's show your book one more time so everybody can write down the name. And I guess it's on Amazon and all over. The Skolnikoff Method. Okay, we got it. So if somebody like me or anybody wants to
see that the coat there on the book, and then I'm wearing the coat.
It's the same one. You don't change your clothes, huh?
No, I just wear this all week. I have like 15 pair of these jackets and these shirts.
I bet they're your uniform. So if any of us watching want to get checked out to find out what our root cause is of a problem, can you do this virtually, you say?
Yeah, we have virtual therapies to help. So they can go to my website, which is mylastname.com, Skolnikoff.com.
And it's right there on our screen, at the bottom of the screen.
Or they can, exactly. Or they can schedule a Zoom meeting at DR and then Skolnikoff.com. Or they can find me on YouTube. I'm a little bit different on YouTube, but you can just search me, Dr. Ilya Skolnikoff. You can find me on Instagram and on Facebook. Usually I also go under Triad of Health, TRIAD, and then and then health. But you can just use Skolnikoff.com.
Okay, great. They would then schedule a consultation?
They would schedule a consultation. Yeah. If they live locally, they can come in. And if they're not locally, then they use the DR and then Skolnikoff.com to schedule a Zoom meeting. We could have a half hour, possibly more together. And right now, for a limited time, there is a special. So a $330 half-hour meeting, they wouldn't pay anything for. Not sure how long that'll last. Maybe even when you see this, it's no longer available, but it is available right now.
It's a complimentary 30-minute consultation. Is that what you just said?
It's available right now, but it may not be available even when they try to use it. Yeah.
Right. Well, today is July 23rd, 2024. So if you're
I just don't want to promise something,
and it's too far down the road, you're just going to have to pay. But does insurance ever pay for work like this regarding hormones or whatever, all these millions of things we've talked about?
Shocking and disturbing as that may sound, it is possible that your insurance company may decide to pay for some of these therapies. However, I will promise you that they will never, ever pay for any type of a Zoom meeting or virtual meeting. They just do not care whatsoever unless you send them far more money than the cost of the meeting. The
Yeah.
insurance companies are all about making the dinero.
Right.
If you
So
try to
people-
find a good insurance company to get help, what you're going to find, I mean, not insurance company, but if you try to find a good doctor to get help and you're planning on having them bill your insurance for you, it'll be many a lifetime before you get the help you're looking for.
Right.
Because insurance doesn't pay for this type of stuff. Insurance is a business. But thank the Lord, we have a variety of affordable payment options that nearly anyone can afford, including people like Sal Sulura over in Ohio. He does catering, and he works in the food service industry, and he's been using my services for many, many years. We helped him lose over 50 pounds and got rid of his asthma and had all kinds of great results helping Sal. You can learn about Sal on my website as well at Skolnikoff.com. And so, yeah, he doesn't bill his insurance too often, but they'll pay sometimes, believe it or not. It's just, even though I'm saying they won't, sometimes they will. So you really need to check with your insurance company and let them know that the bills and the receipts will come under the guise of chiropractic. But it's good to come in every year or two to somebody like me, even if you live really far away. And the reason why I say that may not be for the reasons you're thinking. It's just because your health is worth it. I mean, I truly believe that if you're watching this, or even if you're not watching this, your health is well worth a very huge, ridiculous amount of money that it doesn't sound like it would be worth. But the more time, energy, and money you put into your health, the more you're going to get back. And that can add not just years to your life, but it can help you to be more present with your family. It can help you to think more clearly, get sick less often, have a better and more full and complete experience of life where you can walk and you can talk and you can think and you can feel good and you can experience all the goodness of life that you're supposed to when you were put onto the planet. And unfortunately, terrible and disgusting as it may sound, many of us Americans in 2024 aren't feeling our best. We're feeling kind of down. We're feeling a little stressed, and that needs to change, and it needs to change now, in my not humble opinion. So.
Well, you have given us all a great amount of information to think about, and we certainly need your services. So I appreciate what you're doing for me personally, because I need to schedule a consult with you to check into my hormone therapy, whatever I'm doing. I shouldn't be doing, apparently, and stop my well water drinking, right?
The well water, I would stop right away. Yeah, I wouldn't wait on that. And like, since we did the interview, we have it recorded. You can just go over that and you can call me and we can talk and stuff like that. But I really appreciate your having me. I'm honored to have been here, and you had these great questions. And I don't know, it doesn't sound like you have a lot of other questions. I think we've talked for a while. Do you have any other questions?
Well, I have a lot of questions. Maybe I'll have to schedule to interview you a different time, because we went over our time, and because of social media, it's hard to go too long. But I'd love to interview. Yes, I have 50 other questions, but we just had so much of a good time that I think we got a lot covered, and we got a lot that information that viewers would be enjoyable to learn about. So I'm glad about that.
Trish, just remember, the highest good is to find the cause, according to Hippocrates. That's what he said over 2,500 years ago. And there's always going to be three causes. There's always going to be a structural cause, a chemical cause, and an emotional cause. So feel great and find the cause. Hallelujah.
Yeah. Thank you so much for coming, and we will see you again. Let's interview you again. We would love that.
Thanks,
Thank
Trish.
you, doctor. Thank you so much.